The meniscus is the C-shaped shock-absorbing cartilage, and it's a structure on either side of the knee, the inside of the knee, the outside of the knee, medial, lateral, and it acts as a shock absorber and stabilizer of the knee. Generally, it's thought that a meniscus tear won't heal on its own. Would peptides like BPC 157 help a meniscus heal without surgery? My name's Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. This video is yet another part of my Ask the Doctor video series based on questions you've left me in the comments to the videos on this channel. The question is fairly simple. I have a small meniscus tear in my knee, but I don't want surgery. Would a peptide like BPC 157 help it heal? As always, like all of my videos, this is not an answer where I'm giving specific medical advice. It's meant for general information and educational purposes only. Also, peptides like BPC 157 are considered experimental by the FDA. I'm not telling you should do them. I'm not promoting it. I just am putting this out there for more information. Meniscus tears, yes, typically don't heal on their own. They don't have much of a blood supply, so only in very limited locations within that meniscus is it likely to heal. Typically, it doesn't heal, and depending on the type of meniscus tear and the age, very often that needs surgery, especially in younger people. Now, could you overcome that with something like BPC 157, peptides that are basically, peptides are, and I've done a number of videos on peptides, short chains of amino acids naturally made in our body. BPC 157 is one that comes from our gastric lining, the gastric juice, and labs can basically make synthetic versions of them to replace the BPC that we naturally lose as we get older. Again, considered experimental, but you can get them from approved compounding pharmacies and a number of peptide experts and physicians that use peptides do it. Having said that, I would be very skeptical that peptides that a patient gives himself or herself would work. I don't think either where it's given as a capsule or it's given as a subcutaneous injection, it would get inside the knee, the intra-articular space, to do anything for the meniscus. I'd be skeptical, even if it's injected by a physician directly into the joint, into the knee, that it would help. I have not really seen studies to show that BPC has much in the way of regenerative properties. It may have a role as a pain reliever and could be helpful there, but I would not expect it to help. I might record another video, same topic, but talk about regenerative treatments, exosomes, stem cells, PRP. Could that help? That's sort of a different discussion. Peptides, again, there aren't really studies that I'm aware of for BPC in humans for meniscus tears. I would not expect it to be terribly helpful. Now, if you have an orthopedic injury and you would like to talk about options other than surgery and other than cortisone, I'd love to potentially talk to you. In the description below this video, there's a link to a contact form. You can fill that out and learn more about potentially scheduling an appointment with me. I'd also love to hear about your experience with your injury. You can leave those in the comments below this video. Just understand, if you leave a question in the comments, I can't offer you medical advice, but I might answer your question in a future video like I did here. Make sure to subscribe to this channel, click the bell to be notified when I release a new video and when I start my live streams, including my Ask Dr. Geier live shows. Thanks for watching, and I look forward to helping you feel, look, and perform better than ever.